is highly prevalent in patients with chronic kidney disease and has been linked to poor quality of life, faster kidney decline, and increased mortality. However, pain management in this population is complex, especially because NSAIDs are often contraindicated. I'm Satya Surbhi. I'm an assistant professor and associate director of the Center for Health System Improvement in the College of Medicine at the UT Health Science Center in Memphis. I'm also affiliated with the Clinical Outcomes and Clinical Trials program at UTHSC. I'm honored to present highlights from our recent publication in Mayo Clinic Proceedings titled Trends in Opioid Prescriptions and Short-Term Mortality Outcomes Among Patients with Chronic Kidney Disease and Chronic Pain. Traditionally, opioids have been used as an alternative, but they carry significant risks. In recent years, there's been a national effort to reduce opioid use. This has left many CKD patients with limited options for safe and effective pain relief. Non-opioid, non-NSAIDs analgesics such as acetaminophen, gabapentin, and certain antidepressants are increasingly considered as alternatives. But little is known about how these different medication classes affect short-term outcomes in CKD patients with chronic pain. Therefore, the objectives of this study were to compare the association of chronic opioid versus non-opioid, non-NSAIDs analgesics with mortality and ESRD outcomes, and to examine trends in chronic opioid and non-opioid, non-NSAIDs analgesic use among a cohort of patients with CKD and chronic pain. We conducted a retrospective cohort study using national VA data, initially identifying over 3.5 million US veterans. And from this big group, we focused on about 25,000 patients who had both CKD and chronic pain. These patients were categorized into three groups. First group, those who received chronic opioid monotherapy. Then the second group included those who received chronic non-opioid monotherapy. And the third group received a combination of opioid and non-opioid therapy. We found a notable shift in prescribing patterns after 2014, coinciding with CDC opioid prescribing guidelines. By 2018, over 80% of new chronic analgesic prescriptions were for non-opioid, non-NSAIDs agents. We found that patients on chronic opioid monotherapy had a 12% higher risk of all-cause mortality compared to those on non-opioid, non-NSAIDs monotherapy. Combination therapy also carried increased mortality risk, though slightly less pronounced. Opioid use was not associated with increased risk of ESRD within the 1-year follow-up period. However, cancer-specific mortality risks were even higher in the opioid groups, and this suggests potential vulnerability among patients with cancer. These findings support national trends showing reduced opioid prescribing. Importantly, they also highlight that non-opioid, non-NSAIDs analgesics are not only more commonly used now, but may also be associated with safer short-term outcomes in CKD patients. Our results reinforce the need for caution when considering chronic opioid therapy in this vulnerable population, particularly given the elevated short-term mortality risk. Non-opioid, non-NSAIDs agents may represent safer path forward. In summary, we found that among patients with CKD and chronic pain, opioid use is declining and non-opioid, non-NSAIDs analgesic use is rising, a trend which is aligned with the national guideline. And more importantly, non-opioid therapy appears to be associated with better short-term survival. This highlights a clear opportunity to optimize pain management while reducing harm in this complex population. Thank you for your time, and I invite you to read the full article for more details. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.